The behavioral health market is growing 10% annually. However, for many practices, this rapid expansion creates deep operational fissures that threaten long-term financial stability. A full waiting room and new service lines like speech or occupational therapy often hide a massive revenue hemorrhage occurring behind the scenes. This hemorrhage is fueled by preventable claim denials. Each rejected claim costs the practice an average of $118 in administrative time just to investigate and resolve the error. Expanding clinical services on a fragmented operational foundation leads to eroded profit margins as administrative costs rise to meet the complexity. Consider a multidisciplinary behavioral health practice in Houston, Texas. Despite providing excellent clinical care, they were losing $15,000 every month to over 120 preventable claim denials. Their financial leak was caused by the multi-EHR trap. As the practice added new therapy lines, they adopted different electronic health record systems for each, eventually managing 3 completely disconnected databases. This created massive friction. To process a single denied claim, billing staff had to cross-reference clinical notes in one system, check patient charts in another, and run billing data in a third. This chart shows that the Houston clinic is representative of a national trend. 94% of mental health facilities operate on fragmented software, while only 6% utilize fully integrated systems. Disconnected software acts as a hidden tax, turning routine administrative tasks into an unsustainable 5-figure monthly penalty. Standard medical billing practices often fail to solve these denial issues because of the unique complexity of the behavioral health sector. Behavioral health denial rates are 85% higher than comparable general medical services, driven by shifting rules and complex bundling requirements. This complexity drives a 32% turnover rate among administrative and support staff as they struggle to keep pace with the workload. These administrative failures impact patient care. When prior authorizations are delayed in a chaotic system, children needing therapy can wait weeks for insurance approval. Behavioral health billing operates as a distinct, highly volatile ecosystem that often exceeds the capacity of generalized in-house teams. The Houston practice resolved their crisis by migrating all clinical documentation and billing to a single unified technology platform, eliminating the multi-EHR trap. They also partnered with an outsourced revenue cycle management team that works strictly in behavioral health, rather than trying to manage the specialized coding in-house. This team implemented proactive credentialing management, tracking and renewing provider agreements systematically to prevent claims from bouncing. They replaced end-of-month surprise reports with daily denial tracking and weekly strategic meetings to bridge the communication gap between the clinical and billing departments. Aligning a single source of truth for patient data with specialized human expertise stops the revenue leak at its source. Clinics that adopt this unified, specialized approach see immediate, quantifiable improvements in their operations. Clean claim rates climb from an 80% average to a stabilized plateau of 98%. This accuracy accelerates cash flow. Time in accounts receivable is cut nearly in half, dropping from 60 days to just 25 to 35 days. These efficiencies translate to an average annual savings of $85,000 to $90,000 per practice. Specialized RCM support pays for itself by capturing uncollected revenue and reducing annual administrative overhead. The Houston clinic is now entering its next growth phase, implementing AI-powered pre-claim reviews. By using artificial intelligence to review claims before submission, they project their billing accuracy will hit a near-perfect 98%, stopping denials before they happen. Clinical excellence cannot be scaled without modernizing the operational foundation that supports it. Specialized, unified RCM support secures a practice's revenue and reclaims staff sanity, ensuring that administrative friction never delays patient care.